Did you know if you take antibiotics, it can take up to a year for your body to recover from that? Hi, I'm Dr. Anna Toker, your friendly neighborhood colorectal surgeon. And one of the main things that I take care of in my practice are people who have weird bowel habits. Along the way, one of our jobs is to make sure they don't have colon cancer or an autoimmune disease. Do they need an operation? A lot of these people will have their irregular bowel habits on the heels of taking antibiotics, and it is always distressing when they took the antibiotics for really what sounds like a viral issue or an allergy, or maybe they didn't really need the antibiotics, but they didn't know. They asked for the antibiotics, and the doctor, to placate them, gave them the antibiotics. The point of today's video is to make sure that if you are not feeling well, that you're asking for antibiotics for good reason, because they are not without their side effects. It can take up to a year for the diversity to return in your intestinal tract after you have taken antibiotics. Well, let's say you have no choice. You've got a bacterial infection and you need antibiotics. I see that all the time. What are we going to do to protect yourself against some of the damage that I just described? Number one, take a good probiotic. One of the ones that I like to add for people who are on antibiotics are a probiotic that will contain either a spore containing bacteria, so like a bacillus of some sort that has spore formation, or something called Saccharomyces boulardii. These two things have a tendency to survive the, the antibiotics that you're taking, and then can spring back to life in the absence of the antibiotics and protect the lining of your intestinal tract from overgrowth from bad bacteria. That's step one. Step two, take a prebiotic fiber like inulin. If you don't want to take a supplement, then eat something like kiwi fruit, prunes, some sort of fruit, because that tends to have soluble fiber in it, which contains a food necessary for these bacteria to create something called short chain fatty acids, which is an awesome anti inflammatory for you. If you want to develop your microbiome, you've got to have soluble fiber. The third thing you want to get is something called the phytophenol. What the hell is that? Phytophenol is a plant-based substance that has a lot of color to it. So a purple potato, a red bell pepper, something that has a vibrant color to it will contain a phytophenol. So berries are high in phytophenol. Chocolate is high in phytophenols. These things also are amazing food substrates for intestinal bacteria and can keep them healthy during the stressful times of you and your antibiotics. Next time we talk, we'll describe more about the microbiome and how it helps you, and I hope you guys have a good day.